I guess everyone's joining us here, getting on.
Oh, the subcommittee chair is here.
Sorry about that, everyone. My apologies. I got caught up on a work call trying to figure out a multi-million-dollar delta on a budget that we couldn't figure out. We figured it out. All right, everybody. I apologize for my tardiness. Let's get right to it. Today we have the budget for the Department of Human Services Family Investment Administration. And we will begin with the analysis from our DLS analyst, Tanya Zimmerman. Please, Tanya, take it away.
Thank you, Mr. Chair. The Family Investment Administration's budget decreases by $1.3 billion or 43.5% between fiscal 2021 and 2022. This is primarily due to the Assistance Payments Program, particularly the Supplemental Nutrition Assistance Program, or SNAP, due to COVID-related increases, and we'll discuss that more in just a moment. Exhibit 1 presents some information on the caseload characteristics of TCA. These are cases rather than recipients. Cases often have multiple recipients. This divides the caseload into whether they are work eligible or work exempt. The two notable things about this chart for July of 2020 is that the caseload had obviously increased considerably over the prior year, which is what we generally know about what's happened to TCA during the pandemic. The other notable thing is the share of cases that are work eligible increased significantly. Typically, that share of the cases that are work eligible has declines over time, with core cases, which are the non-work eligible cases, work exempt cases, taking up a larger portion. That increased by nearly 13 percentage points compared to the prior year, and was the highest dating back to July 2001, which is as far back as we have the data for. There were two new programs that were implemented by Family Investment in fiscal 2020. The yellow bar is a transitional benefit, which provides an additional 3 months of benefit at the same level as a case was receiving before they left TCA due to employment. This began to decrease during the pandemic. So from October to February of 2020, the average number of recipients was just over 2,000. During the kind of peak economic impacts of the pandemic from March through July, the number of recipients dipped to, on average, just under 1,200. That began to rise again following that period, and in December was over 2,700 recipients. The other new program was the child support pass-through, which was the result of legislation in 2017, where they began distributing a portion of the child support collections on behalf of TCA recipients to those recipients. As you heard in the Child Support Administration analysis, there were kind of multiple competing impacts of the pandemic and the economic impacts on child support collections, and you can see those reflected in the fluctuating caseload. In fiscal 2020, language in the budget bill restricted $950,000 for a grant to assist in community action agencies in the transition to a two-generation model of service delivery. When funds are restricted in that way, they're required to be reverted if they are not used for that purpose. While the grant was provided, the restricted funds themselves were not released or used, and therefore required to be reverted. They were not reverted at the year-end closeout as they were required, and as a result, the Department of Legislative Services is recommending a reduction of the same amount to their fiscal 2022 budget to account for those funds that were not reverted. The fiscal 2022 budget as introduced plus supplemental budget number 1 had a total of 5 deficiency appropriations for the Family Investment Administration. In combination, they total $1.68 billion. The majority of that, $1.57 billion, is for the SNAP benefits and the related pandemic EBT program for the 2020-2021 school year. An additional $98 million is provided for the temporary cash assistance, both due to the increase in the caseload and the additional $100 per month per recipient benefit that the administration has provided. The remaining $5.6 million is a recognition of some of the federal COVID relief funds that were passed in December. One of the things to note about the TCA deficiency appropriation is it brings in about $17.7 million of TANF. That is effectively all of the balance that remained. So beginning in fiscal 2022, they have to align their spending with the level of revenue that they expect to receive. The other thing to note is that despite the deficiency appropriations of over $1.5 billion for SNAP, DLS anticipates that there will likely be additional SNAP funds brought in through budget amendment in the neighborhood of 100 million or more. The caseload has continued to rise beyond the amount that was anticipated when that deficiency with the calculation of the deficiency appropriation. In addition, it does not yet reflect kind of the impact of the December COVID relief temporary increase in SNAP benefits. The Relief Act that was enacted, Chapter 39, provided additional funds to FIA in 2 ways. One is for the Temporary Disability Assistance Program, and I'll discuss that more in a moment. And it also provides $10 million of additional funding to the Office of Grants Management for the food banks. Exhibit 3 provides information on how the distribution of assistance payments program spending occurs through the allowance. This program represents 85% of the total budget of the Family Investment Administration. As you can see, SNAP comprises the vast majority of that spending and is in fact 72% of the total spending in the agency's budget. Exhibit 5 presents information on the changes in the agency's budget and the fiscal 2022 allowance. So again, as I noted, most of those changes are in the assistance payments program. When you exclude that program, the budget changes by about $12.8 million. The largest change of that is that deficiency appropriation for the emergency food assistance program. There are $3.7 million decrease in personnel expenses. Most of that is due to the abolition of 60 long-term vacant positions. One of the other notable changes is in the employment and training programs. There are a variety of employment and training programs funded through the family investment, targeting both SNAP recipients as well as TCA recipients and non-custodial parents in the child support program. There's a net change of 1.1 million decrease. 2.3 million of the decrease is in the Work Opportunities Program. That program is entirely TANF funded, and they align the spending with the fiscal 2020 budget, which is a pretty normal, typical way of budgeting to align with the most recent actual expenditures. However, fiscal 2020 was an unusual year of expenditures for job training programs. Because of the pandemic, it was the lowest level of expenditures in the program in more than 5 years. And so there is concern that with the TANF balance being depleted and the fact that the TANF revenue that's expected to be available is fully utilized in the budget, that if activities return to a more normal level, there would not be sufficient additional funding to support that return to normal. So we've asked the agency to comment on how they would support a return to more typical employment and training activities for TCA recipients. given the TANF-related constraints and limitations on the commingling of funds with other employment and training fund sources. Again, the biggest changes here are is in the SNAP benefits, and that's to align the spending with the most recent actual after the caseload and benefit increases that are expected, that are happening in fiscal 2021. Despite the decrease, as noted before, we anticipate that the fiscal 2021 budget is understated. We also anticipate the fiscal 2022 budget is understated. It's a little uncertain what the caseload and the benefit levels will look like because the emergency allotments, which allow all households to receive the maximum benefit for their household size, it's uncertain when those will end. They continue until the end of the public health emergency, but we do not know exactly when that will occur. The state also has provided for several years a supplemental benefit for seniors, which is the difference between the benefit they're receiving under the federal SNAP program and $30. So if they receive a benefit of less than $30. The emergency allotment program has effectively temporarily ended that program because no one is receiving less than $30. As a result, all of the funding that is budgeted in fiscal 2021 for that program is expected to be available to address any additional shortfalls because nobody is receiving the benefit. The fiscal 2022 budget assumes that the program is active for the full year at the same level as was originally anticipated for fiscal 2021, which seems reasonable. DLS thinks it's likely, however, that the emergency allotments will be available through at least September 2021. So a portion of that spending is likely to be available to address any shortfalls that might occur in other programs. For TCA, with the changes in the deficiency appropriations, the budget could support a caseload of just about 63,000, a little more than that. As you can see in this chart, after the initial decrease when they restarted recertifications, the caseload has stabilized since they have extended the recertifications again around 61,000. So the funding that they have provided in terms of the caseload is likely sufficient for the caseload. DLS was forecasting a shortfall in the program, however, due to a higher benefit level. And DLS was forecasting a shortfall as well in fiscal 2022 due to anticipated higher caseload. It's really a matter of how quickly the caseload declines. And DLS was a little more cautious in the forecast. The supplemental budget number 2 that was introduced today, however, provides funding to support those anticipated shortfalls. As you heard in the overview, the temporary disability assistance program has fallen to kind of record lows in the cases after the restart of recertifications. In the overview hearing, you heard the department discuss their plan to re-enroll TDAP recipients whose cases closed due to certification and verification issues and failure to reapply during certain months and provide retroactive payments. Subsequently, you also passed the Relief Act, which makes additional changes to TDAP. It requires additional re-enrollments beyond the department's initial plan. It also prevents case closures for reasons other than a final determination on a SSI application through fiscal 2021, and also provides the additional $100 benefit that was provided to TCA recipients to TDAP recipients, beginning with when the bill was enacted. We asked the department to comment on their timeline for completing those re-enrollments and when they expected to begin issuing that additional $100. Because of that re-enrollment, the budget, when it was introduced, didn't account for those re-enrollments specifically. However, because of the caseload that was estimated in the budget, it could have accommodated a certain amount of that. It could not accommodate the level of re-enrollment that DLS anticipates as a result of the Relief Act. However, the Relief Act provided $22 million for TDAP, which is in the budget now. It was processed in a budget amendment. So while there would have been a shortfall with that level of re-enrollment, there will be no DLS does not forecast a shortfall as a result of the Relief Act re-enrollments. In fiscal 2022, it continues to be really uncertain. The budget as introduced had a funding level that could have supported a slightly higher caseload than 2021's budget originally had included. And it did account for the mandated benefit increase. However, DLS anticipates that with the re-enrollments, the June caseload for TDAP will be about 16,900, which is significantly over the amount that is in the budget as it was introduced. However, it's not clear the degree to which the people who were re-enrolled will lose eligibility after when they can begin to terminate people from the program due to reaching the short-term time limit or other documentation verification related issues. So it seems likely that there's a shortfall in the fiscal 2022 budget, but the amount of such is uncertain. For the personnel, there's a reduction of 60 positions. Most of those are in the local family investment program. However, a number of those are not case management or eligibility related. At a December 2020 hearing before the Health and Social Services Subcommittee, FIA indicated that they plan to fill 90 vacant positions to assist in case management and eligibility determination. They indicated that as of February 5th, they had made selections for hiring 15 of those positions and intend to have the full complement of the 90 filled by the end of March. And with the training, those positions would be available about 3 weeks after their hiring date. So they should be available to assist in the case management and eligibility when the redeterminations restart in April. The first issue in the analysis is about some of the flexibilities during COVID for the program. I think we've heard about the statewide processing where they're allowing cases to be processed based on kind of where there's capacity throughout the department rather than specifically where an applicant applies or where they live, which helps accommodate some of the increases that are not spread necessarily in the traditional distribution across the state. This exhibit just highlights some of the time periods for those flexibilities. The emergency allotment is likely to continue. We don't know when it'll end because it depends on when the state of emergency ends. The PEBT benefits, which I'll discuss more in depth later, we expect retroactive payments back to October, but at this point they have not been provided. The other flexibility I'd like to highlight is related to work requirements. Initially, work requirements for TCA were suspended entirely. That suspension ended effective October 1, but at that point they modified the work requirements. As a result of the modifications, most TCA recipients qualify for a good cause designation and therefore are not subject to work sanctions. In addition, able-bodied adults without dependents in the SNAP program, which are typically subject to receiving benefits for only 3 months in a 36-month period unless they're working or participating in a work program. The Family First Coronavirus Relief Act suspended those requirements through the state of emergency. So they are not subject to the work requirements as well. In addition, Maryland has received a statewide waiver of those requirements, which lasts through June 30th. The second issue in the analysis focuses on SNAP benefits for children that are out of school. This is an issue that the General Assembly was concerned about even before the pandemic, but is certainly heightened during the pandemic. The Family First Coronavirus Relief Act authorized the pandemic EBT benefits or PEBT benefits to provide the value of the federal daily reimbursement for free meals to children who were receiving free and reduced priced meals, but for whom schools were closed at least 5 consecutive days. In addition to the children who are traditionally eligible for that program, that also includes the community eligibility schools in which all children receive free meals. The original authorization expired September 30th, and so the benefits were primarily provided for the 2019 and 2020 school year. They were also provided in Maryland in September 2020. The benefits were provided without a separate application. Households could apply to receive benefits if they were qualified but had not previously received the benefit. In addition, for non-SNAP households, the cards were issued to the individual student, which allowed the benefits to be paid when there were situations in which there weren't sufficient data on the head of the household, and also assist in shared custody. The benefits in total that have been provided in the state for the benefits that have been issued totaled about $215 million. In the 2019-2020 school year, the benefits were provided for about an average of 65 days. In September, it varied by jurisdiction depending on the number of days that school district would have been open in September. In addition, you'll note that there were a lower number of recipients in September. That largely reflects students who graduated or otherwise no longer attend an eligible school. They didn't have time to process new applications, but when they are provided the benefits retroactively with the new program, they will be provided retroactively for those households. The benefits that were provided in the 2019-2020 school year varied across the country depending on how many days the schools would have been open. Maryland's level was very similar to the surrounding states who operate under kind of similar school years. Exhibit 12 provides information on the recipients by school district. And again, the majority in general were non-SNAP recipients because of the changes that allow more households than just SNAP recipients to be available. The program for 2020 has some additional changes, is more expansive than the original program, which has complicated the implementation and has delayed the implementation across the country as states figure out a state plan and those get approved. It was expanded to include hybrid schools and mixed statuses, which were not originally envisioned in the program from last year. It also authorizes states to use prior year eligibility for free and reduced price meals, because under the way those programs are operating this year, not everyone actually did the applications the way they normally do. In addition, the program was expanded to childcare programs, which were not included last year. The Consolidated Appropriations Act in December made some simplifying changes that made it easier to implement, including assuming all children in SNAP households are eligible and that all children under the age of 6 are in a covered childcare facility, and then guidance from the USDA allows states to use school closures or reduced hours of operations in the state or in the area rather than the specific child care location. And again, when Maryland's program is approved, retroactive payments will be made back to September or back to October, and USDA is encouraging states to use multiple payments to make it easier on the supply chain and to promote social distancing. The guidance from USDA also required states to communicate with households about how they can decline benefits if they do not wish to receive them. And we've asked the department to comment on the status of the plan and the anticipated timeline for distribution of the benefits and their communications about how to decline benefits. The final section of the analysis is related to the Summer SNAP for Children Act, which was legislation passed a couple of years ago. Fiscal 2021 was the first year of the program. It mandated $200,000 of state funds, which are matched by local funds based on the public school construction cost share formula. It provides an additional $30 in the summer months and $10 in December to households receiving the benefit. Under the program, the jurisdictions apply to the department for the program. 14 jurisdictions applied and 4 were selected to participate. Exhibit 13 highlights the funding by jurisdiction. Montgomery County provided more funding than was required under the local cost share program. The others largely matched what they were required to. Exhibit 14 provides information on the number of children served. Because of the limited funding, even in the participating jurisdictions, only a small share of the eligible children actually receive the benefit. The highest share of eligible children receiving the benefits was in Kent County, which has a relatively small share of eligible households. The recommended actions, the first was the one that was discussed already about the reducing the funds. The second was discussed in the overview analysis, requesting information on the reasons for case closure by program. Recommendation 3, request information on the Summer SNAP for Children program for fiscal 2022. The fourth recommendation requests the spending for the SNAP program be separated out for the pandemic EBT benefits. The fifth recommendation requests information about application processing times and denial rates after the restart of the recertification. And the final recommendation is requesting that they submit the SNAP employment and training program performance measures beginning in their managing for results submission. And that concludes my presentation. I'm happy to take any questions.
Thank you, Tanya. Really appreciate that. Are there any questions for the analyst? Not seeing any. Why don't we go ahead and call the department? Let's see who we have with us today. I had it open and now I don't. There we go. We have the Secretary of the Department, Lourdes Padilla, the Deputy Secretary of Programs, Netzanet Kibret, the Executive Director of FIA, Lashera Ayala, and the Chief Financial Officer of the Department, Stafford Chipungu. Is everyone with us today?
Yes.
There you all are. Madam Secretary, I know you have a hard stop at 3:30. I think we can probably make it, but I know that if you have to leave, one of your staff members will take over. So that's perfectly fine. And we want to hand the microphone over to you and have you present the budget for the FIA on your behalf.
Thank you, Chairman Griffith and Chairman Resnick, for the opportunity to discuss the FY 2022 budget allowance for the Family Investment Administration. And I personally want to thank you for understanding that I might have to leave early. I have to have my second COVID-19 vaccine. So as you stated, I have my team here today, Lashira Ayala, Netzanet Kibret, and Stafford Chipungu. I want to take the time to thank Tanya Zimmerman for her comprehensive and concise analysis of the DHS budget. She's always a pleasure to work with, and We truly appreciate you, Tanya. You do great work. I want to also thank again the local directors and the staff at the local Department of Social Services for all their hard work through their past year, and especially during the COVID-19 pandemic. As I said throughout the budget hearings, without them, there's no DHS. I have my testimony. You have it, which I won't repeat again. However, at a very high level, I would like to address the issues and recommendations from the analysis. I would like to also address some of the accomplishments. Particularly the COVID-19, we all know that created many challenges for the Family Investment Administration. But despite the pandemic, our work had to continue because the benefits and services we provided to families and vulnerable adults in need are essential. The Family Investment Administration said it is the safety net program that now serves over 600,000 more individuals, recipients, compared to pre-pandemic caseload levels, which represents a 61% increase in the number of cases served. The department managed over 1.5 million cases across all the family investment programs. Our world changed, and since March 19th, the department implemented pandemic EBT, as the analyst mentioned. We collaborated with local food banks to distribute over $30 million worth of emergency food assistance. And on December 17, 2020, Governor Hogan announced $20 million in funding to boost the TCA benefits. As a result of the Relief Act, effective February 1st, 2021 through June 30th, 2021, each TDAP recipient will receive a monthly $100 additional payment on top of the regular benefit. Effective immediately, all eligible TDAP cases that close on or after July 1st will be reinstated retroactively to the date of the closure. And the Maryland Relief Act also allocates an additional $10 million for emergency food assistance to the Maryland Food Bank and the Capital Area Food Bank. In addition, we successfully implemented a congressional approved increase in SNAP benefits, the 15% increase that was the result of the provision in the Consolidated Appropriation Act signed by the President. And this 15% increase would remain in place until June 30th, 2021. I'm proud to say that Maryland was one of the few states which secured approval issue September PEBT benefits. And the federal government has also recently increased the daily PEBT from $5.86 to $6.82. And we have also secured $220 million in PEBT benefits for Maryland children. As I stated earlier, we expect $450 million in additional benefits will be issued between now and September 30th. In order to cope with the volume of applications, we changed the way that we process work. We transitioned to what is referred to the statewide process management model, and it has been very successful. And it's a centralized system of processing public assistance program applications, and the goal of the SPM include effectuating that no wrong door principles, reducing eligibility decision timelines, and providing that gold standard customer service across the state. In the FY 2021 budget, monthly TDAP benefits increased by 6.8%, and effective July 1st, 2020, TDAP recipients saw monthly benefits increase from $213 to $243. We continue our SNAP outreach. We currently work with 19 SNAP outreach partners that are authorized to assist SNAP applicants as they apply for the benefits. And I can say that has been very successful throughout the year. The department also maintains a regularly updated, frequently asked document on our website for communication, so our customers know what is happening. And mainly it's been in the response to the pandemic. We also constituted a DHS call center and we had to add staff to cope with the volume, but we have been very successful in doing so. And that concludes my opening remarks. Now, with your permission, I'm going to move to the recommendations and the issues. On the recommendations that are listed on page 3, the department concurs with all the 6 recommended actions. I will now move to the issues. On issue number 2, regarding employment and training activities for TCA recipients, the FY 2022 allowance for this program is sufficient to meet the needs of customers served under the Work Opportunity Program, which is really good. On issue 3, regarding the timeline for completing the Relief Act re-enrollments and issue the retroactive payments, we will complete the TDAP re-enrollments and issue the retroactive payments by March 8th, 2021. On issue 4, regarding when the additional 100 payments will commence, I'm pleased to report that the department we already issued the additional $100 benefit for the month of February yesterday. So all our customers got their money yesterday. And the March through June 2021 issuance will be made on each TDAP recipient standard issue and benefit date. On issue number 5, regarding how the department might respond to a TANF shortfall, we have been advised by the DBM that the governor's supplemental budget, number 2, has added funding to address the shortfall, noted by the analyst. On issue 6, regarding providing an update on the status of the state plan, Maryland's new PEBT plan is pending approval with our federal partners. The tentative timeline for distribution of the PEBT program, including children in child care, will be the following. Includes issue benefits from October through November 2021, will be issued in April 2021, and December 2020, and January 2021 benefits will be issued in May. And regarding the instructions for recipients who wish to decline the benefits, instructions for how to decline the benefits are posted on our DHS website and are communicated by email, by regular US mail to PEBT card recipients. On issue number 7, regarding discussion, the first year of implementation of the Summer SNAP program, approximately 4,000 children received the Summer SNAP program, consistent with the total available budget, with a total amount of $30 for June, July, and August, and $10 December, a total of $100 per child. We allocated $201,000 for Summer SNAP recipients for Summer SNAP program during 2021, and 14 jurisdictions submitted applications to participate in the program. We selected 4 jurisdictions based on demonstrated need, commitment to contribute the required match, and willingness to leverage existing summer feeding programs. That concludes my testimony and response, and I will be happy to address any questions the committee may have. Thank you.
Wonderful, thank you. Are there any questions for the department? Delegate Valentino Smith.
Before I could get to my icon. Thank you. Thank you, Madam Secretary. I know you have a hard stop and we need to go. So my question is, it looks like you're doing, a lot of benefit administration, a lot of money from the federal government, a lot in SNAP, temporary cash assistance, and TDAP. And Ms. Zimmerman showed us in Exhibit 9, there's a runway where some of these programs are going to stop. The additional money is going to stop, or the ability to waive some of the requirements, but the economy might not pick up fast enough by June. So are you developing any kind of plan or working with the governor for a runway for this vulnerable population with some of the federal money that we do have? Or do you anticipate, are you anticipating for this population a problem come around June of 2021, when a lot of this is like with TDAP and TCA and SNAP, it looks like it's all going to come to a standstill with respect to some of the waivers and flexibility and money.
I can say that that's a ongoing exercise that we have been undertaking since March 2020, when the pandemic hit the nation. And DBM and our office is in constant communication, evaluating the trends, the budget, and anticipating what is needed and what steps need to be taken to be able to continue to provide the basic needs of our constituents. So we continue to follow those steps, and in the event that we were to need additional funding, as it just happened now, the conversations with the governor's office and the DBN office would definitely continue, and we'll be ready to act as necessary. What I have found is that this is a very agile exercise. My staff and I, we look at what we need to do in order to also help the participants with employment skills. So when the pandemic hopefully gets better and businesses start reopening and rehiring, that we can have the constituents and our recipients ready with the skill set that they need to become employable. So that's going to be a critical piece of this. We're following what is also happening with the unemployment trends and what the characteristics of the TCA caseloads, which, as you know, have been totally different from the characteristics that we have had in the past. But yes, it's a constant conversation that we're having with the team, with DBM, and of course the governor's office, which is always very supportive.
Well, thank you. I mean, while we're in session, we're your partners here too for this population. Anything we need to change in statute to extend any of that. I know it's federal. Just a final yes or no, I guess, because we're short for time. Have you applied for the maximum amount of extension of waiver for the SNAP recipient programs? I know we're good until June, but what's your ability to ask for a waiver after that? And have you applied for it?
We have applied for the waiver, and it's pending with our federal partner.
Thank you. Thank you, Mr. Chairman.
Thank you. Any other questions? Seeing none, I want to thank the department. Secretary Padilla, we made it on time for you, so we wish you luck in getting your second dose.
Thank you so much. This is our last hearing, and I want to thank the committee and the chairman for all your support throughout the year. Thank you so much.
Our pleasure. It was great to be with you. All right, we're going to call some witnesses who are signed up. I will also, before I call, remind everyone that the House is going back on the floor at 4 p.m. That gives us about 42 minutes or so. Should be plenty of time to get through everyone in a regular pace, nothing to be concerned about. Just want to make sure everybody's watching the clock. So we have a number of people signed up. I'm going to take them in two panels. The first panel, we're going to have Sue Elias from Movable Feast, Lisa Klingenmeyer from Welfare Advocates, Leticia Passarella from the University of Maryland School of Social Work. And that will be our first panel. Whoever would like to start, are they all here? Sue, would you like to begin?
Yes. Good afternoon, Chairs Resnick and Griffith and members of the subcommittee. I'm the executive director of Movable Feast, a nonprofit that delivers medically tailored meals to people in Maryland who live at the intersection of food insecurity and chronic illness. When the pandemic changed our lives earlier this year, we were right where we needed to be. Movable Feast was able to do this thanks to sustained funding provided by the Department of Human Services. We also received supplemental funding from DHS in response to COVID. This allowed us to produce and deliver an additional 61,000 meals, bringing the total amount of funded meals from DHS to almost 150,000. In a year where 1 in 4 Marylanders is facing food insecurity, we have been able to keep Marylanders most at risk for COVID safe and healthy by delivering medically tailored food right to the doors of people who need it. I just want to take this opportunity to thank DHS for their support and the members of this subcommittee for providing funding to DHS to allow movable feasts to feed people, fight disease, and foster hope. Thank you.
Thank you. Let's move to Lisa.
Thank you, chairs and members of the committee. My name is Lisa Klingenmeyer. I'm here today representing Welfare Advocates and Marylanders Against Poverty. These are coalitions that work to address and end poverty in Maryland. We support the Department of Human Services and in particular the work of the Family Investment Administration, which is vital with helping low-income Marylanders find economic stability. I just want to start by saying thank you both to the administration and to the General Assembly for your work during this pandemic. As we talk about often, even before the pandemic, 1 in 10 Marylanders lived in poverty, and Maryland has some of the highest rates of deep poverty among that population, and the pandemic has only exacerbated this. And so we thank the department, we thank this General Assembly for your work to address the needs of low-income Marylanders. In particular, we thank the administration for that extra $100 per household member in temporary cash assistance. We also thank the General Assembly very much for bringing TDAP up to that with some equity and putting in $100 a month for TDAP. We know that those populations will immediately spend that money in the economy, and it's going to help them try and meet their basic needs during this pandemic. We also thank DLS for its report, and we agree on some of the suggestions about trying to keep track around redeterminations and things that are going to be coming down the pike soon, and that we are concerned about with both the volume and how that's going to go. July 1, 2021 looms very large. And we know from the Great Recession, it takes years to rebound from something like this, and it takes the longest for those with the lowest income. And so we encourage the administration and the General Assembly to think about what we can be doing after July 1 to make sure that these Marylanders are still able to make ends meet. We know we're anticipating a large influx of federal dollars from the Biden administration, which can only be used for one-time sort of things. And we think that this could be something this could be used for. Can we extend these benefit increases through fiscal year 2020? And what kind of flexibilities can we continue fighting for so that these Marylanders are able to have what they need as them and their families recover from the pandemic? So we look forward to continuing our work with the department. We look forward to continuing our work with the General Assembly, and we thank you for your time.
Thank you. And as I don't know if anybody saw in the comments, but Ms. Passarella said that she was only here for questions and has since departed. So before we move to the second panel, does anybody have any questions for Ms. Elias or Ms. Klingenmeyer? All right, seeing none, we will move to our second panel of testifiers, Ms. Denise Gilmore and April Tyndall from AFSCME. Oh, and Ms. Velvet Whitehurst from AFSCME, the three of you.
Thank you, Mr. Chair, Madam Chair, and committee members. My name is Denise Gilmore. I'm a field director with AFSCME Council 3. We represent 30,000 state and higher education employees, including the frontline workers for the Department of Human Resources in the Family Investment Administration. I'm going to keep my remarks relatively brief because I think it's important for you to hear from the folks actually doing the work. Thanks for giving us an opportunity to testify today. Our members in Family Investment Administration have been Herculean in their efforts this past year to deal with the unprecedented demand for assistance this pandemic has brought forth. I do want to highlight one concern. We are frustrated that there are PIN abolishments in the FY22 budget. Just because a position sits vacant for a long time doesn't mean that it's not needed. We would prefer to have the discussion centered on why the department is not utilizing these authorized positions that have been budgeted. We hope to continue working with this committee to provide oversight of the recruitment and retention of state employees to fulfill these vital services, including raising wages. I will now hand it over to April Tyndall and Velvet Whitehurst to share their experiences as workers on the front line, and I'm certainly happy to take any questions. Thank you very much.
Thank you. Ms. Whitehurst?
Can you hear me?
Yes, we can.
Okay, good afternoon. My name is Velvet Whitehurst, and I'm a proud member of AFSCME Local 112. I have worked for the Wycomico County Department of Social Services for 21 years. I love helping people, and I'm proud to say that I've helped a lot of people put food on their table during my career. When customers call us, they're in distress, often don't know what to do. They have children that they're worried about feeding, and they just lost their jobs and they don't know how they're going to make their ends meet. Sometimes in tears, they ask me when they can expect to get their SNAP benefits or temporary cash assistance, and I'm so satisfied that I can say tomorrow. I didn't get into this line of work because I thought it would make me rich, but I did hope that it would at least allow me to pay my bills and let me retire with dignity someday. I see how our seniors struggle with the $19 a month in SNAP benefits we give them. In 21 years of state service, I have only received 5 step increases. In the year 2000, when I started, my entry salary was $23,000. Adjusted for inflation, that's roughly $35,000 today. Do you know what the starting salary for a family investment specialist is today? It's $32,000, or just a little bit over $15 an hour. We're making less today than we were 20 years ago. We have 11 positions within the Family Investment Administration that have even lower salaries. But I'm glad that the fiscal year 22 budget bumps those positions to at least $15 an hour, because no one should be making less than that in 2021. But what happens to those of us who have been around for a while and are behind on our steps and don't make much more than that? We're struggling too. There's nothing in the budget for us. And this is not easy work. There's a lot to learn and to know, and policies change frequently. We pride ourselves on having a low error rate that saves taxpayers money and ensures that those that really need it and qualify for assistance get it the most. But errors go up when we have a revolving door of new staff who are constantly in training. And it frustrates our customers when they call and they can't get their questions answered because of the person they're talking to is only 3 weeks on the job. We're not asking for a lot, but we are asking for something. We've seen our caseloads increase in the last year, and we're not coming up for recertifications. We're now coming up for recertifications, and things will be just as busy. We do deserve better. Heaven forbid any one of us would ever be in a position where we will lose our job and need the assistance of our local Department of Social Services to make our ends meet. We would all want to deal with professional, well-trained, and qualified staff who have time to listen to us and assist us in our desperate time of need. Our customers deserve better. Please do all that you can to support us and the work that we do. Thank you.
Thank you, Ms. Whitehurst. And now Ms. Tyndall.
Good afternoon. My name is April Tyndall, and I am a proud member of ASME Local 112. I've been with the St. Mary's County Department of Social Services for the past 7 years. I'm currently a Family Investment Specialist 3, and I work in long-term care Medicaid, assisting people in nursing homes get Medicaid coverage for their stays. Occasionally, I am called upon to process SNAP applications, and I am one of only 2 people in our office right now that can finalize emergency assistance applications for utility and rental cutoffs. I am proud to say that I cover all of St. Mary's County, and I do also assist in larger jurisdictions from time to time with their applications. When I first started in 2013 with the department, there was 15 SNAP case managers, and now we're down to about 10 case managers. The same is for our temporary cash assistance. We had 3 case managers when I started, and now we're down to 1 designated person for TCA applications. We're having a very difficult time recruiting and retaining staff because the pay is so low, and our pins are staying open for a long time, not because we don't need the positions, but just because recruitment is difficult. It's very difficult to bring people in when, if you have dependents, you can actually qualify for the benefits that you are processing for customers. When we're short-staffed, it really harms our ability to be able to help our customers in the ways that we're supposed to. We are unable to fully assess our customers and to meet their needs and make sure that they don't need job placement, housing assistance, if there's a domestic violence situation going on, if they need a shelter referral. It's because we have such a limited time for each customer that we have to move on to the next one without truly assessing all of their needs. I want to be a better resource for my customers, but unfortunately, a lot of times I can't because I'm just stretched too thin. All of this is kind of being complicated by the MD Think transition. I can spend an extra hour or two in one case trying to get the system to do what it's supposed to do on its first try. I often have to duplicate my work by filling out forms so I can get my cases to transfer over into Medicaid system. And I'm also having to fill out forms and generate and print forms and mail them out to customers when the system should be generating them themselves. I also get a lot of phone calls because of the generated notices that they receive are often confusing now with dating and things like that. I'm testifying today because me and my coworkers are doing a really remarkable job with the few resources that we have and the obstacles that we have to overcome daily. With technology and the changes that are rapidly occurring, I really ask that you help us fill our vacancies that we have in our department so we can better serve our community and better serve our customers. As we see with the budget, when our pins sit for too long due to recruitment issues, they're getting cut. And we can't afford to lose any more positions. We're already working with a skeleton crew. So I really thank you for listening, and I plead that you help us help our customers. Thank you.
Thank you. Are there any questions for the three panelists? Seeing none, thank you all very much. We have two more witnesses. Miss Stacy Jefferson from the Behavioral Health Systems of Baltimore and Miss Laura Hale from the American Heart Association. Wait a minute, were those written testimonies? Sorry, those are written. Apologize for that. All right, everyone. That concludes the bill hearing on the family investment, the budget hearing on the Family Investment Administration. I appreciate everybody's time, and we will see you next week. I believe we conclude all of our budget hearings by next Friday. So that is exciting. We should be done shortly, which means we'll be moving on to decisions shortly thereafter. Thank you all very much, and we will see you next week.
Thank you, Mr.